Thank you very much. Thank you very much indeed for inviting me to this wonderful Congress. I am Dr. Taira, neurosurgeon from Tokyo, and it is my great pleasure and honor to talk on recent progress in neurosurgical treatment of dystonias. And over the past 20 years, we have seen tremendous progress in treatment of dystonia with deep brain stimulation. And we now know that deep brain stimulation works very nicely for such kind of generalized dystonia. This is immediately after the operation. And even nearly 20 years later, his symptoms is very controlled. So deep brain stimulation was an impact for practice, and uh, not only for generalized, but such kind of orofacial cervical dystonia can be well controlled with bilateral GPI deep brain stimulation, and the long-term effect is tremendous. It is still working after more than 15 years. However, after many years, we have seen such kind of hardware-related complications, such as infection or rejection, and so on. And every neurosurgeon knows such kind of complication very well. And also the patient may suffer such kinds of ugly scar or bowel stringing. And these hardware-related complications are the most negative side of deep brain stimulation. And for example, this young man had severe axial dystonia like this, underwent deep brain stimulation, which became infected after several years. However, once we stopped the stimulation, he became a dystonic status. So we had to stop it. We have to remove the electrode, but before removing, we made lesions through the deep brain electrode like this. So this is bilateral palidotomy with the DBS electrode. And after many years, after 10 years, he's completely free of symptoms, and he has no device at all. So this is the result of bilateral pallidal lesioning. And this is another example, young lady who had the severe lateral colic cervical dystonia, well controlled with DPS, but infected like this, and we had to remove it. And when we removed the electrode, we passed the high radio frequency current to make a burn in the internal pallidum. So she is free of device and also symptoms free. So based on such kind of experience, we started the lesioning operation with the combination of various anatomical target. And for example, this gentleman had severe orofacial dystonia, treated by bilateral stepwise, of course, stepwise bilateral GPI palidotomy like this. And he became completely symptoms free, as you can see here. And so we can say that he has no device. So we can say that he is cured, and after such kind of severe dystonia. And this lady has cervical dystonia, and also her gait is like this camptocomic bending of the body, and very difficult to walk. But after unilateral single GPI palidotomy, her jerky neck movements disappeared, and her gait became normal. So I am very much convinced that the lesioning operation is very, very important. And so we studied our experience of GPI palidotomy, and we have seen secondary Parkinson symptoms after bilateral GPI palidotomy. For example, among 57 palidotomy procedures, the 23 were staged bilateral, 2 were simultaneous bilateral. Among such kind of bilateral procedures, 6 patients, 25% had the postural instability and the gait disorder, which is refractory to L-DOPA treatment. And some patients had the dysdiadochokinesia or micrographia. So because of 25% the complication is not low, so we moved the target from pallidum to the pallidothalamic tract. We call it now the PTT, or in old days, this area was called the 4H field, where this is the 4H field or PTT, where the outputs from GPI unite together. This is the lenticular fascicles and the lenticularis united together. This part is just above the subthalamic nucleus here, and the ventral oral nucleus of the thalamus here. In case of GPI target, we target ansa lesion. However, with PTT target, we can cover both fibers from the lenticular fascicles and the ansa lenticularis. And we have already published the result of this procedure, pallidothalamic tractotomy. This is unilateral procedure. You can see the lesion here, subthalamic nucleus is here. And this is black dot is mammillothalamic tract. So the PTT area is very visualized with MRI. And even if this was a unilateral study, dystonia scale or score became much improved. And so, and we have already studied the unilateral pallidothalamic tractotomy even for Parkinson's disease. And this is an example of a patient. He had the unilateral GPI and the contralateral PTT lesioning. This is before and this is after the operation. Of course, device free. And already we have been seeing him for several years without recurrence. And this is a young boy with PCAN, neurodegeneration with brain iron accumulation, severe dystonia bilateral. This was before operation. We made a unilateral PTT, pallidothalamic tractotomy. And this is 1.5 years later. You can see the lesion here. And 1.5 years later, he can walk. And of course, not complete, but much better than before. He was unable to stand up before the operation. And this is another example. He had such kind of pineal lesion tumor. And chemo radiotherapy controls the tumor, but he started having such kind of abnormal movements. And we did the unilateral pallidotomy and contralateral, contralateral PTT-tomy, and the final condition is like this. Everything, abnormal movements stopped like this. And this is another interesting example of Huntington Korea, who underwent unilateral pallidothalamic tractotomy. And she had such kind of jerky movements. and unable to walk. But even after unilateral procedure, almost all the correct movements disappeared, and she became able to walk like this. And so it is also interesting that some of our patients who had the palliothalamic tractotomy had epilepsies. And after the PTT lesioning, for example, this patient had the 10 to 20 auras per day, but after the operation, aura dramatically decreased. And another young boy who had the generalized convulsive seizure once a month became seizure free. And this is compatible with very old report of Ginner's 4LH for interactive epilepsy. So we consider the 4L field H or palliothalamic tract Tommy deserves reconsideration as a treatment of interactive epilepsy too. And another important target for dystonia is ventral-oral thumbs. Here, I have reported many times already. This is mainly for task-specific focal hand dystonia or foot dystonia. For example, many musicians dystonia patients had this operation with excellent results. We have already published the result with the large series 171, and the it was picked up in New England Journal, and the result was sorry, the result was like this. The after longest follow up, the effect was completely maintained. And in case of musicians, for example, one means unable to play at all, and the five is complete improvement. So the effect is dramatic, and there are no severe adverse events. And this is an example of a patient with a violin, and his focal fifth finger flexes like abnormally flexes like this, and he has difficulty of playing violin like this. But after operation, her fingers became completely normal, and he can play very smoothly like this. And another example, drummer with abnormal flex opening like this. And after this is operation like this. And this is after operation. And this is another example of musicians dystonia. This is called ambusher dystonia, or mouth or lip or tongue dystonia. And here you can see air leak from the left mouth corner, like this. And this is during operation, and still air is leaking from here. And he's counting 1, 2, 1, 2. We are checking his voice and his motor function while making a lesion. And this is immediately after making a lesion in the pallidum. So the response is immediate. And so this is very dramatic. So today we not can say that even ambusher dystonia can be treated with stereotactic operation. And also, such kind of focal hand dystonia may be seen in a young girl. She is unable to write, and this is after surgery. She's writing Japanese alphabet like this, very smooth. And such kind of focal dystonia occurs in the foot, and when he goes down the stairs, he his left foot become inverted, but while going up, it is completely normal. This is an example of task specificity, and after vento-oral thermotomy here, his gait became completely normal. And focal hand dystonia can be seen in many sports athletes like this. This is table tennis player, and this is before treatment, and this is after vento oral thermotomy, like this, or even the world ranking tennis player who had the wrist abnormal flexion. And
I mean, for sure, 100%.
Yeah. Okay, you're feeling different?
Feeling a little bit different.
Okay.
the patient said 100%. Okay.
Keep swinging because then you can experience it more.
Okay. And also, we can treat musicians' cramp with gamma knife. This is an old lady who had the warfarin or aspirin because of cardiac issue, and the operation was contraindication. And before treatment, she can't use the first finger. She can't use the thumb with like this. So, so this is a typical example of pianist cramp. And 1 year later, after gamma knife, she became like this. This is after the operation. All the fingers, she uses all the fingers like this. So, but I don't recommend gamma knife to everyone because there is unpredictable side effects, and the effect takes time to appear. But also, but it is natural for us to move such kind of treatment with using MR guided focused ultrasound. For example, this was the first musician's cramp treated with focused ultrasound thermotomy. We have already published it 3 years ago. And another example, pianist cramp, pianist cramp or dentist cramp and so on, treated with focused ultrasound. And we already finished a 10 case feasibility study, and with good result. For example, in case of writer's cramp, rating scale became much improved immediately after, but there was a small tendency to recur. But in case of musicians, the effects were maintained up to 1 year. You can see the focused ultrasound lesion, vento-oral lesions here, but even after 1 year, it became almost invisible. And also, we started the focused ultrasound pallidotymic tractotomy for Parkinson's disease. And this is now under investigation. Almost we are finishing the final case. But if you look at this lady, she is completely akinetic, and she can't move like this. And we made a lesion here. This is a subthalamic nucleus, and this is a lesion made by focused ultrasound. And this is immediately post-op medication off stage, and she became able to walk like this. Okay. Still not complete, but you can see the dramatic change after making a lesion in the pallidotymic tract. And in case of focused ultrasound, PTT is very advantageous because more centrally located than GPI, and it is easier to raise the temperature, thermal temperature here than GPI. And also this part can be visible based on the subthermic nucleus or the mammillothermic tract. And also the volume necessary to control the symptoms is very small. So in conclusion, the lesioning plays a very important role in management of dystonia. And with modern technique, it is safe and effective. And in case of deep brain stimulation, it is a kind of just control of the symptoms. Patients have to carry the device for life, while in case of lesioning, we can bring cure of dystonia. But still, the lesioning is underutilized. And also, as a new target, hydrothermic tract or 4H field is very, very important area. Thank you very much for your attention.